All right, we're going to call this Human Services Committee meeting to order here. It is February 18th, 2026, 4 p.m. And we're going to start off with courtesy of the floor. If anybody has anything they would like to speak about, discuss here at this committee. All right, seeing none, we are first on the agenda going to have an update on Graysdale. It had been my hope to had this meeting, quite frankly, a couple weeks ago. I was on vacation with my family, something that we had scheduled last summer. So that being said, I'm looking forward to diving into this update. Ms. Wondolowski, I know Ms. Morton is here as well. So if you'd like to provide us an update as to some of the ongoing issues and how we're addressing some of these as well.
So for the, maybe Ms. Fada, maybe you're the only new person, well, Mr. Holland, but he knows Michelle. So this is Michelle Morton, our administrator at Graysdale. And we plan to start tonight by giving you guys the answers to the, like there was a bunch of questions asked when Tara and I presented 2 weeks ago that we didn't have the answers to. So Michelle has all of those answers, and then she is here to answer any other questions that you will have. So thank you. Thank you, Michelle.
Thank you, Ms. Morton. Appreciate you being here. How would you like to do this? Because I did watch the meeting on YouTube after I gotten back from my vacation, and I know there were a bunch of questions that you were going to provide answers to. Do you want to go through those at this time?
Yes,
Okay.
because I listened to it as well, so I wrote down each question. That way I would have the answers to each question.
Perfect,
So I believe I
perfect.
caught all the questions.
All right, feel free.
So the first was a question about staffing and care. So no, we have not received any violations connecting staffing levels to resident care. All facilities must meet or exceed minimum staffing regulations. Regarding our training hours, all staff complete required orientation, annual training, and any additional sessions based on resident needs or staff performance. So for example, last year we held mental health first aid training that was attended by about 20 staff members because that was an additional need that we saw. Nurses' aides must complete at least 12 hours of training per year. And then common topics include resident rights, infection control, safety, etc. Regarding mock surveys, our mock survey does not include simulated incidents or reporting. We don't have any concerns about the accuracy or timeliness of our reporting. Employee discipline. An employee under investigation is immediately placed on administrative leave and removed from all resident care duties. If an allegation is confirmed, the individual is terminated. If not, they are reinstated. Elopement. Elopement refers to a situation in which a resident leaves the premises or a safe area without the facility's knowledge and supervision. If necessary, that would be considered an elopement. So the definition now depends on the resident's individual cognitive abilities. So we have to assess each case based on that resident and their safety risk, as well as balancing resident rights. Census numbers, we also balance admissions carefully to maintain both financial stability and quality of care. Residents are screened before admission to ensure we can meet their needs while managing risk appropriately. And then elopement technology, we use a WonderGuard system for residents identified as at risk. So to strengthen security, we recently added badge swipers to each door to ensure resident safety for our 2 dementia neighborhoods. So those are the questions from last time.
Those are the questions. Thank you for answering those. One question that I did have, and it's something that I haven't heard necessarily brought up in the 2 years that I've been on council, is when it comes to trauma-informed care training. I know that it does go on at certain areas within our county government. And I would assume that it goes on with regard to the employees at Graysdale as well. Am I correct in that?
That's correct. That's
Okay.
actually one of our regulatory requirements is to do
Okay.
training on trauma-informed care.
Okay.
And then if we and we assess residents for trauma. So even trauma in the past, we assess for what types of things might re-trigger that trauma, what is the best response for that individual resident. So they're care planned very individually for any trauma.
How often do folks end up getting, quote, retrained? Or is it a training that happens every year, once every 2 years, or just one
Yeah.
time when they are hired?
All the standard topics are both upon hire and annually, but then if we identify a need, and that could be an individual or a group need, so if we find a particular individual needs additional training, then that individual could be retrained. If we see a pattern, then it could be everyone. So
Okay.
it really is based on what we see as a need.
Okay, thank you. Does any committee members have questions?
I do.
Commissioner Keegan?
So these are more questions that I would like answered for the public than for myself. Some people would like to sell Graysdale. They say that, we're losing money, blah, blah, blah. There's only 7 county nursing homes in the state, correct?
Correct.
Okay. When somebody has insurance and they've bought insurance for long-term care, they have this money, they have Social Security, they have their husband's pension, and maybe their husband has passed away, and they have all this money, they could afford Graysdale, or they could afford any other nursing homes in the area.
Correct.
Possibly. What happens if there's somebody who is not well off? Only like minimal amount of money. They have no money. What happens?
Well, then they'd be eligible to apply for Medicaid, but then they would only be able to go to nursing homes that are Medicaid participating providers, which is not every nursing home.
And are there many in our county, in Northampton County, or?
I don't know the actual number, but yeah, not as many as just nursing homes in general, obviously, because not every nursing home accepts them.
Okay. So many nursing homes could just say, no, you don't have any money. We're not going to take you, right? It's only Medicaid or Medicaid accepting.
It's a little more complicated than that because there's other ways, like if you have a retirement community, a lot of times if people have moved in while they had money and had a certain amount of assets, then sometimes they have benevolent care funds. So there are some that would take people that under that, would be
No, they're
paid,
wiped out.
But it's
They have
just-
no
yeah.
money, no house
For
to take,
initial
nothing.
for initial admission, it would be only those that are Medicaid certified.
So Graysdale is very important for
Correct.
us
Yes.
to maintain and figure out a way that we can make it succeed.
I believe so.
Okay, I do too. I have always felt that way. All right, thank you. That's it for right now.
Any other members of the committee would like to address Ms. Morton in terms of Graysdale and issues that were talked about at the last meeting?
I just have a quick
Yes,
question.
Commissioner Fadum.
We were given our packet here, and I see a number of statement of deficiencies from 2025. When were the most recent deficiencies? When were you notified?
The most recent was our staffing, which our plan of correction date is February 19th.
And that's the only one for 2026 so far?
Yes, we've had 2 inspections recently, and both of them resulted in no deficiencies.
Okay, so everything that's in front of me has been abated, resolved?
Yes, everything other than the staffing has been closed. We had our plan of correction, we implemented our plan of correction, the state came back and reassessed, and everything was found to be in full compliance. So the only open issue is staffing.
And what is being done to correct that?
With staffing, we've been working with our staff as well as our agencies to make sure that we have the proper staffing, managing call-outs carefully and our backup plans for call-outs, making sure the schedule is clear and And we did meet our struggle had been Sundays. Last Sunday, we did meet our staffing, and we're looking good going forward. We expect to clear that.
Yes, Commissioner Keegan.
I don't believe anything I hear, really. I always take it with a grain of salt, but this is a rumor that I heard, that some workers at Graysdale had that didn't like the prior administration and wanted to see things fail. And when there was not enough staffing, they called it in and were basically whistleblowers. Now, I don't know if that's true. I'm not saying it is true, but that's what I heard. Is there a policy against whistleblowers?
There is a policy that states that if someone is doing an honest whistleblowing, against something that actually happened, then there is a policy that they're protected if if it was an honest call. There's no way to track. Calls can be anonymous. So some of the recent complaints we believe came from some staff and they were unfounded. But who's to say whether that person honestly believed what they claimed or not? So I can't say that someone did it maliciously, whether they honestly thought it was an issue. All I can say is the complaint was turned in, Department of Health investigated, and everything was unfounded.
Yeah, I wouldn't think that anybody would want to do that. That's cutting your nose off to spite your face. It's like their job and livelihood, so why would they want to do that? I didn't believe it.
Anybody else have anything for Ms. Morton or with regard to this particular discussion? Mr. Holland?
I was going
Yes,
to
Commissioner Holland,
defer
sorry.
to my colleagues, but in the absence of that, I will speak. Can you take a minute to introduce the people that you brought with you? Because I think it's important for the council to meet the other leadership team. And I'm pleased that you brought them today, so thank you for doing that.
Yeah, they come every meeting.
Okay.
So I have Christina Casey with us. She's our Assistant Nursing Home Administrator. And Nicole Diefendorfer, who's our Director of Nursing.
Great, thanks. So I'm just going to go through some of I thought you were going to kind of go through the executive's Graysdale plan. So I'm just going to follow up on some of those because they're kind of all itemized here and ask how those things are going, because it was the plan that was presented to us. So there is one of the things was that a written report was going to be submitted to the Director of Human Services and the County Executive on a biweekly basis. Can you let us know what were some of the highlights of those reports and what are some of the things that you're working on in addition to the violations to hone policy and practice and just work on, general improvement?
Sure. Well, I actually already do a weekly update, so we're sending that along. But we're adding additional items to it for the administration. And most of those items, I can tell you, I would report as they occurred anyway. So this was just a more formal way of putting them in writing and sending them in. And we haven't finalized everything that we're putting in those reports yet, but we are including details, how was staffing during the week, what meetings and initiatives do we have, any incidents that we may have had, if any, what training occurred that week. So basically just the activities of that week. So.
In the past, we talked about providing a dashboard of data. Have we made any improvement or work toward providing that, or what would be included in that? Because that was probably about 2 to 4 weeks ago.
Yeah, we didn't make a decision on exactly what we would do with that at this point. We're sending the reports to administration.
Okay, thanks.
Just to add
Sue.
just to add some clarity to that too.
Perfect.
I think that's in the works, but the priority was the biweekly report that essentially is a snapshot of like every single thing that happened at Graysdale for every, those prior 2 weeks. So I think once we, I think I told the Director of Administration that even though Michelle has already sent a lot, that starting this Friday, we would implement or tomorrow or next week, start the biweekly report in a formal process. I think that if there's specific things that council would like to see on that dashboard, certainly you can let us know. We'll figure out if it's something that's doable or not doable. And I think Michelle has some ideas for making that dashboard much more useful to council than what we submitted previously. But we want to get it right and not have to keep redoing it for you. So once we get the biweekly report ironed out over the next week, we can start to take a look at that.
So that would be by,
The dashboard, well, that would be for Human Services meeting,
no, but by what date, what time, let's.
the next Human Services meeting.
Okay, so in 4 weeks.
Well, I don't even think
Actually,
it's 4
2
weeks from
weeks.
now.
Oh, 2 weeks. Mr. Holland,
Oh, right,
yeah.
right, we're already
Yeah.
2 weeks behind. Perfect, okay.
Yeah, my vacation unfortunately messed up the schedule for this month.
And if we run into any issues with
that's good.
that, then we will certainly let you know if there was an additional 2 weeks needed, since they're so close. But
Right.
I don't think that, we certainly can at least get an initial dashboard. I suspect we'll need to make some modifications
I think
for
it's
you.
just helpful to have something to work from as far as the data and showing positive trends so that we can talk about those positive trends.
Happy to,
You know, and areas that we need improvement.
absolutely. Michelle has spent a exorbitant amount of time getting all of us back up to speed, and we're very appreciative of that. And so, absolutely. So that's in the works, and we will get that 100% to you guys for sure.
I will say, I don't think it needs to be a perfect dashboard right out of the gate.
No, let's
something
start with
that
a
we can-
draft.
Exactly,
Let's
something
just-
that we
yeah.
can.
A
work
working
towards. Yes.
document for, for that information.
Yes.
So that we can talk about it and have that information. Yeah, that would be really helpful. I have just some general comments that I can address to my colleagues, but I don't want to do that while we have Michelle here. So if I could just reserve some time to just have general discussion, where that fits in.
Yes, Commissioner Holland, we can
Or we can
absolutely do that.
now if Ms. Morton is.
It specifically deals with Graysdale?
Yeah.
Oh, then why don't we get into
Okay,
that?
yeah,
For
thank you.
sure.
Thanks.
Okay.
So I know, I just wanted to have an opportunity to have a dialogue amongst, is anybody on the phone or not? Lori's on, okay.
I believe
I
Commissioner
am.
Largo Hefner is, yes.
Just general
I did
comment.
have a question. Can I ask a question quickly?
Absolutely, Commissioner.
Sorry, I didn't mean to cut off Mr. Holland, but I thought, I think that I had a question and I can't remember the answer regarding the provisional status. And if there was, I think they said the length was 6 months. Was that not correct? Is Ms. Morton still there? I see she
Yes,
walked away from.
that's
the podium.
correct. 6 months, which actually
And is there-
coincides with the date of our regular, when our regular license renewal would be done anyway.
And is there anything that we are not allowed to do, or any,
No.
I guess what is the clarification of provisional status?
I would think of it more of just like being on notice that, okay, yes, we had the incidents that occurred, which we believe we have worked in depth to solve. So the license, it does state that we are in substantial compliance. So we do believe that that will be lifted when we get the reinspection. And there's no consequence as far as there's no hold on admissions or anything like that.
Thank you. And also regarding the short-term rehab, is that affected in any way, or is that considered separate from this survey?
No, that's
Because
all
it's a
part of the
separate
same license.
service.
So it has no impact on that either.
And what's your census today?
496.
And how many of those are the short-term rehab beds?
I believe it changes frequently, so I believe it was 6 today.
And are any of our payees affected by this?
No.
Or have any payers said that we're not going to? I know like Lehigh Valley Hospital lost a major payer. I just wondered if any of that was trickling to the nursing home.
No, we have not lost
because
any
of
payers.
provisional, but just in general.
No, we have not lost any payers.
Are you finished?
All right,
I'm
I think that's all I have. Yes,
I
thank
do
you.
have a couple follow-ups. I apologize.
Yes.
Since you're back.
Commissioner Holland, go ahead.
Thank you. I need to get recognized. I need to learn that. I'm sorry.
All good.
So your mock survey is scheduled for when? What
Next
dates?
week.
Oh, next week. Okay, great. And that'll be a really good indication of, again, validating some things, everything that's going right, and recommendations of regulatory changes.
Yeah, they're going to do a survey that will mimic what the state will do when they come out because it's always good for us to self-identify if we have any potential concerns so that we can correct them. So that's what's called mock survey. I would say for things that we're doing well, our quality measures points have been going up steadily over the last 3 quarters. So we anticipate that trends continuing. We're 36 points away from gaining up to a 2-star on our quality measures. So as I said, that's been steady progress. That's been really positive. We've had positive comments from families, residents, and even staff. So a lot of comments from all of them in support of us saying that, yes, we are headed in the right direction. So I honestly feel that, the issues that happened were a storm already on the horizon that, was already pending. And so the storm happened, and now our team has weathered the storm, and we're moving forward.
Analogy to use. So clarification on the timeline. The last inspection that was at Graysdale was January 8th. Is that accurate? Or
I believe the next one was February, I can't remember the date, I have it on my notes, but we've had 2 recently for complaint inspections. So they both came in with people who had called in multiple complaints, and both of those inspections resulted in no deficiencies.
The revisit on the 8th that I'm looking at cited staffing, so I'm not
Oh, well,
clear.
we had 2 complaint inspections that had no violations. The staffing is the one that is set with the plan of correction date for February 19th. So just a couple days away.
Maybe my colleagues can help me here, but I thought we sat here 2 weeks ago and asked to be notified of any inspections in the facility, since the only way we could learn that was through the delayed CMS and DOH websites. So now I'm hearing we had, 4 inspections?
No. 2? 2.
Okay, all right, two's better than 4, but still, where
Okay.
was the breakdown in the notification of council?
Number 1, I knew you wanted to be informed of DOH visits with citations. Happy to inform you, happier to inform you of DOH visits with no citations. We just need a minute to get everything that we're asking of Michelle underway. And I think that it is reasonable, now that Michelle is also here tonight, that we certainly can do that. I can notify, if Ms. Shifnisky or, wants me to notify her, and then she notifies all of you. Happy to do that. But certainly if there had been any deficiencies since our last meeting, I absolutely would have communicated that to you.
I don't remember hearing about the January 8th visit until I read it somewhere, so I'm not sure if we knew about that 2 weeks ago, but we can figure that out. Yeah, just an email. Department of Health is in the building. We'll keep you updated. I mean, as long as the executive is fine with that. I don't want to
No,
overreach.
we will certainly
but I think it's
notify Ms. Shifnisky
I
when they're
think, yeah, I think that
done.
would be helpful. Again, just more information, the better. And if it seems in any way, and you guys can clarify or jump in any way you want, that council may be asserting a little bit more, I think we have pretty much 100% reason to insert based on based on what we're looking at. And at some point, hopefully, can back off a little bit of that. But from an oversight standpoint, I think it's really important that we know this information.
I have no problem with council being informed because especially with this, is stuff you'll find out anyway. And I would rather you all know in real time.
Right, that would be helpful.
When DOH comes, shows up unannounced, Michelle will always send me a text, and once she knows what the complaint is, she'll let me know. And then before the end of the day, she will let me know if it was substantiated or unsubstantiated. Certainly moving forward, what we can do is send a quick email to you, Aileen, if that's all right, with that information once everything is said and done. I won't do that before they're done because there's no point in 3 emails to instead of 1.
Right, and sometimes they don't know, right? They were taking it back to the office, we're gonna talk about it and get back to them. Yeah, does that seem reasonable or acceptable to the committee, or does anybody have any?
I think it seems reasonable and acceptable, and quite frankly, it's those situations that come in, the complaints that come in that are not substantiated, where whether somebody is calling in a complaint just for the sake of it, to play games, whatever the case is, I would like to know that so that, with regard to what Commissioner Keegan was talking about, so we can actually sit back and say, you know what, there is some nonsense going on, and you know what, Graysdale is being run in this capacity, the way that it's supposed to be run. So if we have the information that, yes, a complaint came in, but it was not a substantiated complaint, I think that's good for us in terms of letting the public know that, yeah, just because a complaint comes in doesn't mean it's 100% accurate.
Correct.
So, and I think that's an important aspect of this angle too, that I believe that you're talking about, Mr.
No, I
Holland.
think
So-
first of all, we talk about celebrating our good news, right? And that's, honestly, that's positive news. I think that Michelle and I and the county executive very much want the support of county council, and you can't give us that if you don't have the information. We're not gonna be perfect. So I'm not saying that nothing will ever, that we'll never forget or, something like that, but I'm telling you that we are committed to doing that, and we will make it happen. And there was other things that I had to have Michelle get done first. But that was on me because they were unsubstantiated. So I will include substantiated and unsubstantiated moving forward.
Perfect. Clarification is always helpful. We can't be supportive and respond to people unless we have the information to do it.
Yeah, and I can just tell you that the date was the 6th, which was the date of your last meeting. So this is the first meeting since that date.
This says January 8th, and we met on February 6th.
Yeah, there was one February 6th.
Okay, February 6th, okay.
Yeah.
Okay, thank you, I appreciate that. Yeah, I think that was it.
Yeah. All right, thank you.
Mr. Holland, do you have anything else?
I do, so just some general
yes,
comment. I
yes.
mean, I think that from the council standpoint, and I'd like to have feedback, is this appropriate to have just discussion amongst ourselves?
I think so.
Okay, perfect. So two things. One is, I think we might need to look at, and, we can obviously get administration's input into this, but if we cannot staff the facility with more county workers at the current census, I think we need to potentially look at doing an analysis of what units have the fewest patients, what units are 100% staffed by agency, and look at temporarily reducing the size of the facility so we can care for the residents with county employees in a way that we're not going to have any issues with staffing and these ongoing deficiencies. We have to find a way to get out of this loop of that we're in with staffing being an issue and this, having too many agency staffing. That may involve taking a revenue hit, and that's something that we would have to acknowledge and kind of reconcile in some way. What is that expense versus revenue ratio? What is that analysis? I know that in the Affinity Operation Assessment 3 years ago, they did an analysis about reducing 4 beds to 2 beds, and this would be the reduction in staff and the reduction in revenue, something like that, where is there a place for us to start reducing temporarily occupancy until we can make sure that we have a handle on the staffing issue in particular, so that we can make sure that we are doing what we need to do. And I'd like to hear anybody's comments on that.
Well, I would, as chair of the committee, I would say I understand the direction you're going in. My concern with doing that is what could be the adverse effects of that in terms of overall care for the Northampton County community in general. Because hypothetically speaking, and I don't necessarily know how many residents come into Graysdale, and I'm sure we're going to be talking about this more in the coming months. How many residents come in, and when you're talking about the census, it does fluctuate. But hypothetically speaking, say we embark on that endeavor, and we get 16, 18 individuals who have no place to go, as Commissioner Keegan was talking about earlier, but we've implemented this policy and this reduction. What happens to those individuals? That would be the trepidation that I would have with right now at this moment as of us talking about this, and without having data in front of me, without diving into it really at this point from a more micro standpoint. That's the concern that I would have. I understand because of the challenges we're facing now, where you are coming from, but that would be my concern, is what do we do with folks who desperately need this facility during certain points of the year, especially from a rehab standpoint too, and how would the rehab facility also be affected by this too? Like I said, I'm not sure if folks remember, I mentioned last year a couple times, Greystone was the only place that would take my mother last year when she was in and out of rehab facilities. There were 2 specific rehab facilities here in the Lehigh Valley that said they just would not take her anymore. And yes, it was because of a funding perspective and standpoint. But I want to make sure we have the ability to serve people who truly need it at the end of the day. So I'm hearing what you're saying
Yeah,
for sure.
Absolutely. I think if we take, I mean, some of these units are like 30, what's the smallest unit? Like 30 beds, one of the northwest, right? We're not talking huge. So if we close down a 30-bed unit and, I mean, our capacity is, I think, 585 and we're at 495. So we literally have 100 beds somewhere. So I don't think that would be as much of an issue, taking 30 beds out of service, reducing all that nursing agency staffing out of there, and LPN, CNAs, reducing that agency cost, reallocating that agency staff somewhere else, or just taking that out of it. I think those beds are going to be available somewhere else. I mean, so I'm not sure, but I guess the question is, should we have a conversation about it and look at the numbers and see what that looks like? And does that make sense? And obviously get input from anyone else.
Of course, we would obviously want to, of course, have input
Okay.
from the administration
So
and even the
that
county executive
is-
as well. But is there any other members of council that would like to?
I think that's interesting. It's an interesting idea. I would like to hear maybe from the administration to see what they would have to say. Like, what's the other side, or do they like that? I don't know.
Right, I just don't want to be accused of putting something on them without advance notice. That's why I'm having a discussion amongst ourselves. But if they're happy to engage with that, that's obviously an option. But I don't want to have an expectation without having had some previous discussion
Sure.
with respect to Madam Executive.
I'd be happy to share my
Yes.
thoughts on that.
County executive, go ahead.
Thank you, sorry. I think that before we start having conversations about how to manage Graysdale from a distance, that we really have to take a good look at the numbers. Like when you talked about the dashboard, and we look at how many agency nurses we have right now, we're looking at about 60%. So if we reduce our occupancy by 60%, leaving only the nurses that, and this is all hypothetical, because I don't think we want to do that, because that would require us to discharge individuals as we speak. So we definitely don't want to interrupt their care or treatment or rehabilitation. But I think the reduction of agency nurse dependency is definitely important. It's an important conversation. It's not something that's going to happen overnight. And we would be left with, we have 688 beds. So I'm not quite sure if you're talking about decertifying those beds.
Absolutely not talking about disturb. I'm talking about temporarily closing a 30-bed unit to reallocate staff, and that's it.
So it is very tricky, because even if you do have just regular nursing staff, the scheduling of the staff might still require agency even if we reduced. So it's about, that's a scheduling issue and a management issue. And I think that we're trying to do everything that we can to reduce agency nurse dependency. And also, I think it's going to really help when we implement some of the plans that we had discussed in the previous meeting. So on a dashboard, we could indicate some things like PPD or resident occupancy. We could indicate surveys, the number of surveys. That could be something on the dashboard. But I think the information that you're going to want to receive is information about those kinds of numbers. And we can report the agency staffing, and hopefully we can keep reporting deductions in that dependency. But right now, we can't interrupt the care, treatment, or rehabilitation of current patients. we could stop taking patients in residents, but then that would require a financial loss again. Like there's a ratio that you're trying to hit for reimbursements, and I think you might be familiar with that, like 85% occupancy. One of the things that we discussed was potentially reorganizing the bed situation in terms of possibly decertifying 20 or 25. And that would be to make room for a dialysis center. But doing that again might require the flow of staffing that we don't know if we're going to be able to staff agency or the nursing staff that are career staff or Graysdale staff. Do you know what I mean? It would make, I believe that it would make the job more difficult on management. And I think they're already trying really hard to mitigate these situations. And I know that Michelle and Sue are in contact with me just about every day about what's going on at Graysdale. And we are trying to change the public opinion somewhat. I don't know if you saw the article or the Valentine's Day video that we put out in, not only on Facebook, but like on WFMZ. They came and they saw Ray and, was it Dorothy? Ray and Dorothy Sylphys. They had a beautiful sort of like vignette of their love affair for the last 60 years, you know, and he's coming to visit her. So we do have caring staff, and I don't want to discount the need or the effort of our agency staff as well, because they do provide care and service, and I know that they are expensive, but we are working on that. Does that make sense?
Yeah, it makes perfect sense. I was not implying in taking people off of a unit, putting them into other empty beds, closing the unit, and reallocating the staff. It wasn't that kind.
I don't think
It
he
wasn't-
meant the
yes.
entire
Commissioner,
agency, all 60%.
Oh, okay,
Right.
because I was
thought it was
gonna.
me. I'm like,
No,
did I say
no,
that? Because
no.
I did
I
not
thought
mean
you.
to say that.
I really
That was
thought
the
that
case.
that's what you were saying.
No, that's not what I was
saying,
saying.
and that.
An incremental change that would probably maybe not interrupt.
So if
That was all.
So if there's.
I'm glad that we clarified that
apologize.
point, but like, so that is important, the clarification, and I'll let her talk.
Yeah, I just wanted to add that we already do have 2 units that are closed, so we already have condensed. We don't have enough open beds to close another unit and move people. So it's physically, it wouldn't work right now. Because each unit only has a couple of empty beds or a couple of empty rooms.
Fair enough. Thank you. Can I have one other topic?
Yes, Mr.
Yeah,
Hall.
thanks. So
Yes.
just back to the pub, first of all, thank you for bringing up the Valentine, because I did see that, I read that, and that Valentine's Day event and dance was always one of my favorite things at Graysdale. That like warmed my heart when we did that, because it was always so much fun. And isn't that when they they nominate the king and the queen, and there's a court, and there's a whole, like, it's a whole event, and it's really quite lovely. Yeah, exactly. It's a really fun event. So I'm glad that you mentioned it, because I wanted to talk about it tonight and I forgot. Yeah, always a highlight. So to your point about public perception, one last thing that I just feel compelled to bring up, and that is, you know, there's trust in leadership, perceived or otherwise, and there's been a lot of discussion about the county nursing home, and, you know, arguably or not, you know, a violation or a lack of trust that the county has the ability to figure out how to run the county nursing home and do it efficiently. And I think we need to have a discussion about bringing in a third party to validate all of the good work. Yes, Ms. Morton, I'm bringing it up again. I saw the look to the county executive. Bring in a third party like Affinity Health, who has experience in the facility, to validate all the good things that Ms. Morton and her team are doing at Graysdale with an independent third party, saying these are the great things that are happening there. These are some areas for improvement. I think that it would help public perception. I think it bolsters all the things that we're hearing from the administration and from other members of council. I think it affords an opportunity of transparency. And quite frankly, I don't really see the downside in it. I mean, I had a discussion with the administration and it was not looked upon favorably, but I'd like to get feedback from my colleagues of what you think about that, for the reasons that I talked about. Validating, confirming, and/or suggesting improvement from a third-party expert.
Tatum, did you?
Or yes, I can get behind that, David. I mean, public perception is not very favorable toward Graysdale right now. People are looking to us to resolve it, and our administration. We have 496 souls at this facility that we are responsible for caring for. When I see reports of violations noted by the Department of Health, it's very disheartening to me to see this. I'm glad to hear that these issues were resolved. However, I don't want to keep kicking the can down the alley, for lack of a better term. I do want to see actionable items going forward in these weekly reports on how we are going to fix this situation and make Graysdale the facility that it once was, the facility that our residents deserve. And if bringing in a third party is going to help us do that, I can get behind that.
Commissioner Keegan.
Okay, so I don't see it that way. I feel like we have a new county executive who has plans to, her own plans, and we've had a fantastic administration that comes here, and they've been doing, trying different things. Why would we pay more money to a third party to tell us that our current administration is, yes, telling the truth? Don't we believe them? I believe this administration when they come up here and tell me that. And as for public perception, we have one person that continues to trash Graysdale on a continuous basis, and I would put a lot of blame on that person. I think we all know who he is. Every single day, constantly writing about Graysdale, and if that person would stop doing those things and we could believe the administration and what they're telling us, why would I pay a third party to tell me that they're telling me the truth? I believe them already. That's how I feel about it.
Any other members of the committee have any thoughts on this? Commissioner Vargo Hefner, do you have any comments or?
Yes, I do. Thank you, sir. Back to Mr. Holland's first point about the reduction of beds or maybe not refilling those beds for a period of time in order to get staffing under control. I support that idea. And again, with respect to the fact that we're not looking to move an excessive number, but I think on the former dashboards that we used to receive, there was always how many admissions and how many people had left the building or had passed on. And so I think if you just don't renew those who are passed on for a short period of time to reduce the census to get manageable, I think that's an awesome idea. As far as the suggestion of bringing in Affinity, they spent time and we spent money doing a survey years ago. It would not be bad for them to come back in and offer any kind of assistance and guidance. I would rather have that happen sooner than later because I believe she said we are on a 6-month timeline. And so it's not a matter of seeing that the administration isn't doing their job, but to be supportive, to offer other ideas and practices to get rid of that deficiency once and for all. I support that.
Anyone else have any comments before I make my comments here? All right. It's an interesting notion, Commissioner Holland, and I think we need to create a sense of balance with this at this point. And it is certainly not lost on me, no one on this dais, no one who is sitting in council's chambers, how critically important this facility is to our county residents, especially our aging population, and how we want it to be better. Every single person wants it to be better. And I'm looking at this as a county executive who was just elected, who just took office a month and a half ago and had a tidal wave absolutely crash down on the county executive's office, the administration, the folks at Graysdale, the folks who are running it at this point. Do I think a third party might be necessary at some point down the road? I do, but the actionable items that Ms. Fadum talked about, that I think we need to see how they potentially come to fruition and in what manner they come to fruition. I guess this is me saying we need to give this administration a chance at this particular point in time here in mid-February. Might things be different at the end of April, May, if we are not seeing a dashboard that we are particularly caring about or care for? If, for whatever reason, we are hearing about a lot more substantiated complaints coming in when we get the emails eventually, then yes, I think absolutely diving into that third party is probably going to be necessary. But I think at this moment here in mid-February, we need to have some balance. And in my opinion, let the administration, and the voters did elect County Executive Zirinsky to try to help manage this county in various ways, this being one of them, to give them that opportunity at this particular point in time. But I do not think we should absolutely close the door on it. That's my particular thought. So, absolutely, Commissioner Holland, yes.
So, fair enough. All that's fair enough. I'm talking about, bringing in a consultant maybe once a month to do that, but I think it's important to talk about it. That's the only goal. That's the goal, talking about the downsizing and the right sizing, bringing in a third party. We have to have these discussions. We have to have them in public. We have to have them in the open. All those comments, Kelly, Commissioner Keegan, your comments, everybody's comments, fair. I don't want to be misconstrued as, overly advocating for it, but I think we have to have the discussions. We have to be open. We have to talk about all the options that are on the table. Unfortunately, we don't have the luxury of time because the play out of the provisional license, if things for some reason don't go wrong, and I think everybody in the room, certainly this room over here, knows how things can happen in a nursing facility that you have no control over, and they come out of nowhere and you have to deal with them. We're on this timeline of this provisional license, which leads to provisional 2 and denial of payment and other issues, and we cannot afford to go down that road, not for lack of anybody's effort, but just the general situation of what happens in nursing facilities every day. So we have to be just laser focused on making sure that we're doing everything we can from a governing body and from an administration to make sure that we're moving forward so that we don't get ourselves into a situation in a couple months that's going to be more of a crisis.
Understood.
I'll stop talking.
Understood. I am pretty sure that this committee is going to continue to monitor things, not only as it pertains to Graysdale, but human services in general. So with that being said, and we know that we do have a Personnel and Finance Committee meeting coming up too. Next on the agenda, we wanted to get an update, and I spoke to Commissioner Holland about this, an update on human services divisional staffing. I'm not sure if I've actually ever gotten one in the 2 years that I've been here, so I think it'll be interesting and valuable information for this committee. Ms. Wondolowski, thank you very
Thank
much
you.
for taking the time to give us some data here.
Absolutely. And just a reminder, I know we talked about this 2 weeks ago, but Affinity will be at Graysdale next week. I know Michelle mentioned it too, to do that mock survey. And as I said last time, and certainly we can report back on that at the next, next time Graysdale's on the agenda. That's that we pay them to tell us the 50 citations we in theory could get, right? So it's That's the point of it. But that said, it will do exactly what you're talking about. And so, more to come on that, and then we can go from there. Okay, so I will save the aging sort of staffing positions for, that's on the Personnel Committee. There's 2 position upgrades there. But I wanted, sorry, to just give you an overall quick synopsis of how we're doing things and what, like, our vacancy numbers and stuff like that. And then we can, whatever additional information you want, happy to provide. So each week from Human Resources, Katie Hunsaker gives out this lovely spreadsheet. This is just for DHS. And it lists all of the job posting numbers, the job title, position numbers, whether they're advertised internally, externally, opened, closed, bucket post, all those things. So that has been a tremendous help. Once we were out of civil service, our HR department kind of took over that management piece. And so when folks apply to jobs, our HR department is the one that goes through all of the MATs, the minimum education and training requirements for each position. And then, they follow all the career service regs, which I will not bore anybody with. So I would say that overall for staffing, we're actually doing pretty well. So here's what I have. In terms of vacancies, really the 2 places we have those are aging and children and youth. And that's always, look, children and youth is always going to be the case. So currently we have around 30 vacancies in children and youth, and that's spread out across clerical, legal, fiscal, caseworker, supervisor, administrative support, which is about 20 higher than I would like it to be. And that has been an ongoing discussion once we were out of civil service. I think part of the reason we still have that number is because at some point about 2 years ago, we are now being a little more deliberate at who we hire. We get so many folks to children and youth who have no prior experience, at all. And that can be okay if you have the capacity to learn. But the hardest piece is, will you like the job, right? I mean, that's, child welfare is a hard job. And so what I can say about that is we still today have more people in seats in children and youth than we did 8 years ago. And the reason for that is because I think over the last 8 years, we've added, I forget the number, I think it's like 42 positions. So yes, we have 30 vacancies, but had we not added those positions, we would be full. So again, that is absolutely a high priority for us to get those filled. But the good news is, one of the things that my children and youth folks do in particular, because they have the highest turnover, is they monitor that on a yearly basis, right? So how many people left? How many of them worked here for less than 6 months? How many worked between 6 and 12 months, and so on and so forth? And I would say so the numbers I have are dating back to 2020, and the numbers range between 30 and 43 individuals who left each calendar year, and that's just from children and youth. And in 2025, that number was, I hate to talk about this out loud, but that number was only 21. So vacancy rate improved substantially. And at a later Human Services meeting, when we talk about CYF, happy to talk about some of the cultural things that are happening, some of the policy things that are happening. There's a lot of overall culture shifts that we have been working on for a long time at DHS, so also can talk about that. But I would like to think that all of those things are helping with that turnover rate. Nonetheless, there are vacancies that have to be filled. And the other place, generally with vacancies, is in aging. And so we have some aging care manager 2 positions that are vacant, a case aide, a manager. Okay, roughly those are the ones. The protective services workers and our options unit, again, we can talk about that in aging, when you want to have aging come, but they're just different divisions within aging. So protective services is the one that we are absolutely legally required to provide, and if nothing else existed, protective services has to exist. So we definitely have struggled over the last year with finding folks, again, who will, appreciate and understand what the job will be. And then, it's not, again, not an easy job to go into the homes that, our folks go into on a regular basis. So, so those are the ones that we are looking to fill. So all of our vacancies are posted. Now, children and youth, if you go on, you're not going to see 30 positions posted, because the, like, caseworker twos, that's just like one bucket posting, right? So maybe you'll see 4 positions posted. That's why. Certainly I could explain that if people had particular questions. And I think that's it, except for I'm going to save the aging piece for personnel. But any questions? That was super quick. And so
It was.
if people want more info, I'm happy to get that.
We do have a time requirement
Yep.
for
Nope, I'm
personnel
good.
and finance too. So with that being said, in terms of the biggest challenges, I would imagine it's what you mentioned, Ms. Wondlowski, simply folks going into homes and they don't know what they're going into. It's a pretty scary situation at times, and I don't want to,
It's true.
catastrophize
Yep, no,
anything
that's true.
or be negative about it, but there are certain realities with these jobs. Do you think that is the biggest challenge?
I think
in
it's-
term- in
I'm
terms
sorry.
of trying to fill these jobs?
I think it's a big challenge in terms of retaining folks, right? We can tell people all we want. I will say that our aging folks, we worked within the last few months to revamp their interview questions and their process, because we just felt like that could use some work. And honestly, one of the things that they do is they show pictures of hoarding houses and older adults with wounds. Like, these are things that you're going to see when you go into the homes. Like, there's no textbook that can prepare you for that. And a lot of these folks are, 24, 23, 25. So I think that we're trying to adapt to the generational differences and figure out how to do that. So happy to talk at a future meeting about like all the retention efforts we're doing. Definitely have work to do with filling vacancies for sure.
Any other members of the committee have any questions before we adjourn?
Thank you.
Commissioner Giovanni.
Yeah, Mr. Holland, I think after provincial, it's provincial 1 and then provincial 2 for the ratings on that Graysdale.
That's true. Yeah, there's
You
3.
said
You can go up to,
provincial, then went to provincial 2,
oh,
but it goes
right.
to provincial 1.
Okay.
Just a clarification.
Thank you.
Anyone else have anything for the Human Services Committee before we adjourn?